Hey there, my friends. Have you ever woken up with that nagging ache in your upper back, wondering, what did I do to deserve this? Or maybe you've been hunched over your desk all day, and now your shoulders feel like they're staging a full-on rebellion? Well, you're not alone, and I'm here to help you take back control. I'm Dr. Anna Schneider, a physician with over 15 years of experience helping people just like you conquer back pain and reclaim their lives. Today, we're diving deep into understanding the causes of upper back pain. Buckle up, because this isn't just a science lesson, it's a wake-up call to empower you, to make you proud of your body, and to show you that you've got the power to feel amazing again. Let's do this together. Picture this: you're trying to enjoy a walk in the park, play with your kids, or even just sit through a movie, but that upper back pain is like an uninvited guest who won't leave. It's frustrating, right? I've seen patients cry in my office, not just from the pain, but from feeling like their body has betrayed them. And I get it. As a doctor, a mom, and someone who's had her own battles with a cranky spine, I'm here to tell you, this isn't your fault, and it's not your destiny. Upper back pain might be common, but it's not unbeatable. Today, I'm going to break it all down for you: why it happens, what's going on in that incredible body of yours, and how you can fight back. Because you deserve to feel strong, free, and in charge again. So, let's start with the basics. What's really causing that ache between your shoulder blades? Quick question for you: have you ever noticed when your upper back pain flares up the most? Drop a comment below and let me know. I'm reading every single one. Okay, let's get nerdy for a minute, but don't worry, I'll keep it simple and fun. Your upper back, or what we doctors call the thoracic spine, is this amazing powerhouse. It's made up of 12 vertebrae, those little building blocks of your spine, stacked between your neck and lower back. These vertebrae are tougher than you might think. They're built to protect your heart and lungs while keeping you upright. Attached to them are your ribs, which wrap around like a shield, and a whole team of muscles, like the trapezius, rhomboids, and latissimus dorsi, that help you move, lift, and twist. It's like an orchestra, all working together to keep you going. Pretty cool, huh? But here's the thing: this area isn't as flexible as your neck or lower back. It's designed for stability, not wild acrobatics. So when something throws it off, like poor posture or a sneaky injury, it doesn't take much for those muscles to scream, "Hey, we need a break." And that's where the pain kicks in. So, let's talk about what's throwing your upper back out of tune. Ready to be your own detective? Let's go. 'Cause number 1, posture, the silent saboteur. Alright, confession time: how many of you are watching this slumped over your phone or laptop right now? No judgment, I've been there too. Poor posture is the number 1 culprit I see in my practice. When you hunch forward, your shoulders roll in, your head juts out, and your upper back muscles get stretched and strained in ways they weren't meant to handle. It's like asking a rubber band to stay stretched out all day. Eventually, it's going to snap back or just give up. Over time, this can tighten your chest muscles, weaken your back, and voila, hello, upper back pain. But here's the good news: you can fix this. Sit up straight right now, shoulders back, chest open, chin slightly tucked. Feel that? That's your body saying, thank you. Start small, 5 minutes a day of good posture, and watch how your upper back starts to cheer you on. You've got this. Tell me in the comments, what's your biggest posture struggle? Desk job? Phone scrolling? I want to hear it. Next up, muscle overuse. If you're a gym warrior, a parent lifting kids all day, or even someone who's been painting a room, your upper back might be working overtime. Those trapezius and rhomboid muscles I mentioned? They're champs, but they're not invincible. Repetitive motions, like typing, lifting, or even carrying a heavy bag on one shoulder, can make them tight, sore, and downright cranky. I had a patient once, a carpenter named Mike, who came in with upper back pain so bad he couldn't swing a hammer. Turns out, he'd been overdoing it without giving his muscles a chance to recover. Rest, stretching, and a little TLC turned him around. So, if you're pushing hard, listen to your body. It's okay to take a breather, you're not weak, you're wise. 'Cause number 3, stress, the invisible weight. Now, let's talk about something we don't always connect to back pain, stress. Oh, my goodness, this one's sneaky. When you're stressed, whether it's work, family, or just life, your body tenses up. Your shoulders creep toward your ears, your breathing gets shallow, and your upper back becomes a storage unit for all that tension. Sound familiar? I've been there. As a doctor, I've had days where I'm so wound up, I can feel my upper back locking up like a vault. But here's the secret, you can release it. Deep breaths, a quick stretch, or even a 5-minute walk can start to melt that stress away. You're stronger than the weight you're carrying, I promise. What's your go-to stress reliever? A hot bath? A good playlist? Share it below, I might steal your idea. 'Cause number 4, injuries, the unexpected guests. Okay, let's get real about injuries. A fall, a car accident, or even sleeping funny can tweak your upper back. Whiplash, for example, doesn't just affect your neck, it can ripple down to your thoracic spine and muscles. I've treated patients who didn't realize that old fender bender from years ago was still haunting their upper back. If you've had an injury, even a small one, don't ignore it. Your body's telling you something, listen up. 'Cause number 5, medical conditions, the rare but real players. Finally, let's touch on something less common but worth knowing, medical conditions. Things like scoliosis, a sideways curve in your spine, where arthritis can affect your upper back. Even issues like a herniated disc or osteoporosis might play a role. These are rare for upper back pain compared to the lower back, but if your pain's persistent, severe, or paired with symptoms like numbness or weakness, check in with a doctor. You're worth it. So, we've uncovered the culprits: posture, overuse, stress, injuries, and sometimes medical conditions. But here's where the magic happens, you don't have to just live with this. Your upper back isn't your enemy, it's your ally, waiting for you to take the reins. Let's talk action steps you can start today. Ready to feel proud of your body again? Let's go. Step 1, fix your posture like a pro. First, posture. Stand tall, roll those shoulders back, and imagine a string pulling you up from the top of your head. At your desk? Get a chair with good support or even a rolled-up towel behind your mid-back. Small changes, big wins. Step 2, stretch it out. Next, stretch those muscles. Try this, clasp your hands in front of you, push them forward, and round your upper back, feel that stretch? Hold it for 20 seconds. Then, pull your shoulder blades together like you're squeezing a pencil between them. Repeat that a few times daily, it's like a love letter to your upper back. Step 3, move more, stress less. Get moving. A brisk walk, some gentle yoga, or even dancing in your kitchen, motion is lotion for your spine. And for stress? Breathe deep, inhale for 4, hold for 4, exhale for 4. It's simple, but it works wonders. Step 4, know when to seek help. If your pain's sticking around or getting worse, don't be a hero, see a doctor or physical therapist. You're not giving up, you're taking charge. Alright, my friends, here's the truth. Your upper back pain doesn't define you, it's just a signal that your body's ready for some love and attention. You're not broken, you're resilient. You've got the tools now: posture, movement, stress relief, and I believe in you. I've seen patients go from despair to dancing, and I know you can too. So, stand tall, take a deep breath, and tell yourself, I've got this. Because you do. Now, I want to hear from you. What's one thing you're going to try today to tackle your upper back pain? Drop it in the comments, and while you're there, tell me where you're watching from, your city, your country, wherever you are in this big, beautiful world. I'm so curious. Oh, and if this helped you, give it a thumbs up, it means the world to me. Let's keep this conversation going, share your thoughts, your struggles, your wins. Together, we're unstoppable. See you in the comments.